Hi, I'm Leslie Thompson for the Plastic Surgery Channel, reporting from the 2009 annual meeting of the American Society for Aesthetic Plastic Surgery. I am joined today by Dr. Brett Snyder, who is a board-certified plastic surgeon based out of Ponte Vedra Beach, Florida, which I've never been to and can't pronounce. But Dr. Snyder, thank you very much for being with us this morning.
Thank you.
And I wanted to talk with you a little bit about some of the new trends that are happening in surgery, cosmetic surgery around the eyes, because I know this is an area of interest for you and something that you've been taking a lot of notes on during the sessions here. Tell me about some of the new trends that are happening there.
Well, the trend in lower eyelid surgery now is a trend towards less is more. As so many people know, many people have lower eyelid surgery, and both in the short term and the long term, their eyes look different. And patients will tell you that's not really what they're looking for. They're usually looking for trying to correct some of the hollows around the eyes. Everyone complains about dark circles. Everyone complains about a little bit of loose, crepey skin. And the nice thing about the modern trend in lower eyelid surgery is toward a less invasive approach, and toward an approach that's more towards trying to correct the fine lines and wrinkles and correct the depressions and the hollows around the eyes in a way that's not lifting like it was in the past, but actually using fat from the patient's body to fill those deformities in. Believe it or not, we're just now coming to understand the underlying features of facial aging. And it turns out that facial aging is largely volume loss. People used to think it was sagging skin. It's not really sagging skin. Even around the lower eyelids, our skin doesn't sag. It's not from gravity. It's from loss of the natural body filler, which is fat. And so we're now using fat more and more around the eyelids to try to give a more youthful look. And then in terms of addressing the skin of the eyelid, we're trying to be much less aggressive. We're avoiding operating on the muscle itself so the patient maintains that nice natural lower eyelid shape. We're trying to achieve more, but we're being less aggressive in that process. And the end result, and it's really been borne out by a lot of the nice results presented here, is that patients have a very nice, natural, relaxed, rested look, but they're not going through these procedures that have very long recoveries and that give them a pulled look or that distorts the lower eyelid shape.
So in terms of the fat grafting, how does that work? Where does the fat come from, and what process does it go through that surgeons can then use it as part of the eyelid surgery?
Well, as you know, most of us have some fat that we don't like in certain areas, and the classic comment from the patient is, I'm losing the fat in my face and it's going elsewhere. And so the concept now is taking some fat from other parts of the body, and we do this utilizing some slightly modified liposuction techniques so that we're preserving the fat cells, and then we're transferring these into very small syringes using very small blunt tip needles to actually put this fat where it's needed. One of the most exciting things about this new trend in fat grafting is we now understand that it's not just the fat cells. There's actually growth factors and there are even stem cells in all of our fat. And we think that a lot of the effect that we're getting from this fat grafting is actually from those other components of the fat grafts. So that's a very exciting area, and there's an enormous amount of research being done right now with this. In terms of the patients, in terms of being practical about it, what we do is we will take some fat from elsewhere, and if we want to do a little liposuction in that area, that's a great time to do that as well. And then we prepare that in using very small incisions, or even just using a needle to pass this blunt tip needle right to where the fat needs to go, so it's very safe, tends to be very effective, and gives long-lasting results.
So what if you have a patient who may be just very slender and doesn't necessarily need any liposuction or have a place that you can get the fat from? Are there alternate techniques to just get enough that you need?
Well, there are. You can almost always find the small quantities of fat that you need around the eyelids. You may not be able to find enough fat to use in other parts of the face, but in terms of the eyelids, it's a very small amount, and you can almost always find that fat. There are some patients who prefer not to have something else done, and in those patients, you can use one of the dermal fillers in those areas. Now, you have to be very careful with those, and also the patient has to understand that this is going to be something that's going to have to be repeated over time, and it's something that we do very commonly right there in the clinic. So that doesn't require a trip to the operating room. It is going to have to be repeated, and it really requires that the patient or that the the surgeon doing this technique has a lot of experience with those fillers, because we've all seen patients with unnatural appearing lumps or other problems, and so often it comes from practitioners who really don't have the experience necessary to do that safely.
Excellent. Well, Dr. Snyder, thank you so much for your time. We appreciate having you today. And thank you for joining us. I'm Leslie Thompson for the Plastic Surgery Channel.